Hello, everyone. My name is Kaya Kirsch, and today I will be talking about the maternal mortality rate in the United States and programming that can be used to reduce the effects that it has on the population. The health topic I decided to focus on was maternal death. According to the World Health Organization, maternal death is defined as the annual number of female deaths from any cause related to or aggravated by pregnancy or its management during pregnancy and childbirth. This excludes accidental or incidental causes. The goal of the Healthy People 2030 initiative is to reduce the number of maternal deaths, and the rate in 2018 was 17.4 maternal deaths per 100,000 live births. When looking at maternal mortality rate overall, there are disparities among various races, with Black women having the highest rates of pregnancy mortality. This is thought to be caused by a lack of access to early prenatal care, inconsistent monitoring by an OBGYN, and a history of discrimination that can affect a patient's environment, their health, and the availability of health resources. Because of this large disparity, the program will focus specifically on pregnancy-related deaths within the African American community and improve the medical care African American women receive during and after their pregnancy. Compared to the national average, in 2020, the maternal mortality rate among Black women was 55.3 deaths for every 100,000 live births. That is 3 times higher than that of white and Hispanic women. As you can see from this chart, the rates overall continue to rise. However, within the Black community, the numbers are rising at an alarmingly faster rate. So then what is the solution? This is where the Here For You campaign comes into play. The goal is to reduce the African American maternal mortality rate by 20% in the next 5 years by increasing the public's recognition of maternal warning signs. So what should audiences know? The communication should be informative to the audience. Primary audiences will hopefully feel empowered to advocate for their health needs with their healthcare providers. They should also be well-versed in indicators that an issue is occurring so that they can seek medical attention as quickly as possible. For secondary audiences, such as loved ones, they will be informed on how to support the primary audience. This support will come by learning about health concerns that can be dangerous. Healthcare physicians can also learn how to actively listen to a patient's concerns and create an environment where a patient feels comfortable talking about their concerns. So how do we reach the audience? There are a few different forms of communication that will be utilized for this campaign. For the broadcast media, the program would air on commercials for channels that appeal to pregnant women between the ages of 20 to 34. Posters, flyers, and informational pamphlets would be distributed to physicians' offices, hospitals, public health facilities, daycares, and prenatal service providers such as parenting or birthing classes. Participation in community events such as community resource fairs would be ideal for distributing educational materials to the public. Audiences will most likely be reached when accessing healthcare services. This is when the primary audience will have the opportunity to speak to their healthcare providers by voicing concerns and asking questions. Audiences can also be reached during the designated times when ads are run on television, and that usually occurs in the evenings when most people are home. The tone of the campaign should be informative and emotional. The audience should feel connected to the ads, and it should make an appeal that is heartfelt, but also filled with important information. If the audience is able to see themselves in the campaign, they'll be more encouraged to invest in its message. Audiences will also be likely to talk about what they saw with others if it has made a significant impact on them. To ensure the intended audience is being reached, the Here For You campaign will be rolled out within the state of Texas first. According to the Pew Research Center in 2019, Texas had the largest African American population with about 3.9 million people. Once the evaluation results are reviewed and there is evidence of goals being obtained, the campaign can then be implemented elsewhere. Florida has the second largest population of African Americans at 3.8 million, and then Georgia with 3.6 million. These states would be next in line when the time came for campaign expansion. The program has been implemented and the data collected. So then how do we evaluate it all? The program can be measured using a mixed method approach. Methods for measurement would be focus groups, surveys, and individual interviews. Focus groups and interviews would allow the opportunity to hear direct feedback about the campaign's messages. And surveys are helpful in gathering a large amount of data that can be evaluated. By using the mixed method approach, the program can see qualitative and quantitative results to get a full scope of where the program is doing well and areas where improvements need to be made. With time, dedication, and hard work, I am confident that the campaign will come to fruition. Thank you.